one love, family. Today is a very special, special day. We are doing a celebration of life birthday Ghanaian dish called Oto or Eto.
Wanyama kalo, tababa wale. Nyande. You are all welcome to today's discussion on education versus medication, which will be the best option for us to take. Let me start by talking about education because I'm a trained educator and teacher myself. Most of the times, when we talk about education, we think an educated person is the one with a huge stock of certificates. But true education has a generational impact. When we are educated, it burns like fire in our hearts, and it gives us the love of impacting others. And our ancestors, being Africans, have practiced this form of generational education for a long time. You may even call it the apprenticeship system, where people learn directly from family members or masters that they serve. And it continues because it is practiced in everyday life. And because of that, it is very difficult for you to miss anything that education has to impact to make society worthwhile. Whilst medication on the other side, although they talk about health care, actually what medication does is sick care. Because unlike having natural products like where how New Earth is having CKLS and all those things, that puts your body in its natural state. Chemical care is targeted towards only symptoms and it doesn't go to the root cause of the problem. And I want to tell you that a poorly informed person is easily deceived and destroyed. That's the reason why in the chemical industry, they will not like people to have the proper knowledge about their own self. And they will tell you that with proper health care, with proper health education, our teachers normally possess what we call in science proof of concept. So if you travel in Africa, especially in Ghana, and you go to any town or village, you have any health problem, it is very easy for your next door neighbor to be able to tell you that, oh, if it is a childhood sickness or problem that you have, oh, mommy so and so or papa so and so at this side of the village is very much experienced in treating children's problem. And it is not because that individual is having a huge stack of certificates or papers from any institution. It's because of what they have seen physically, what we call proof of concept. They have seen the person really cure somebody. And most of the times, such references are well deep-seated because they normally don't fail. It is something they have done. And even in our traditional healthcare system, as a way of life, nobody goes to school to learn about how to put zalopia, which we popularly call wintia, into the first porridge that the toddler being weaned off takes. And just recently, it has now been discovered that it's a very powerful antibiotic. Our ancestors knew it hundreds or probably thousands of years ago. And this practice has saved a lot of our children from getting sick, and also it has helped them to be very robust with their health. It builds up their immune system from the word go. Immediately after breast milk, the porridge that they give them contains this zalopia. This is what I was talking about, the wintia. People then have to go to a special institute to go and learn about this. This is knowledge that is handed down in families from generation to generation. So those were the days that you don't have anything like come and take a vaccination against some killer diseases. Other than that, your child will be sick and die. They were protected from day one. In fact, most children in Africa are even protected from the womb before they are born, because it's put on a certain diet, and a lot of it helps them. That's why it is very rare to see people who take the traditional diet of a pregnant woman here. They normally don't have pregnancy-related hypertension and all that. And to prove to the world that the white man brought his Canaan to the bush, but the bush was stronger than the Canaan. When the colonialists faced the problem of malaria, their medicines could not help and they were really dying. So they have to go back to nature. And so this neem tree was introduced from India to Governor Gurgisberg. And so in Ghana, the first neem trees were planted around Ridge area. So some of the oldest neem trees we have in Ghana are between Ridge and then the Children's Park in Accra, because they planted them directly from the castle. They were completely overwhelmed by malaria because the quinine and other medicines from Europe at that time could not help them. So it was this neem tree which was prescribed from India by Governor Gurgisberg. It was prescribed to Governor Gurgisberg, and they went ahead and used it. Today there are a lot of people who even think that herbalism is fetish, so they don't even want anything to do with natural health. But even in those days, it is these herbs that help them. And because of the knowledge of the herbs and their continuous usage, a lot of homes in Ghana made sure that there are particular herbs which were always around the house, like these scent leaves called nunum. They always had it around, and it was even introduced into soups, especially palm nut soup, with other edible herbs, which really helped to build up the immune system of both mother and child. Today, you hear people talking about going to get vitamin A for the babies. When the mother gets enough of the palm nut soup with a lot of dark leafy greens, I don't see why the breast milk will be lacking in vitamin A for the child to be given an artificial vitamin A. And today there is an emphasis on going to get vitamin A from Europe, dropped on the tongues of our children to help them. And I don't see how Europe that do not have palm oil can have a better vitamin A than us here, because palm nut itself is having a lot of vitamin A. And our ancestors did not attend any white man's school, but they will normally tell you that if you want good eyesight, use a lot of palm oil. So our natural way of living is the healthiest. Those days you don't wait until children are neglected, and then when they become sick, then they rush them to the hospital, either in ambulances or in taxis, so that they will have to rush and put a drip on them because they are between life and death. Our eating system was properly organized, and the children learned from the adults the importance of eating fruits. It is known that the more fruits you eat, the better your chances are of staying healthy for a longer period of time. We have, those days there was nothing like dehydration, because when you are going to the farm, you have very clean waters. There was nothing like galamsey. There were very clean waters in the streams and the rivers that people scooped and drank as they were traveling to the farm in the morning. And nobody ate in the morning. The knowledge of health was at the fingertips of every parent. Especially our women were taught how to give enema to children, the herbs they have to use, when they have to do that, how to even massage the child as the child is growing. And all those natural forms of health helped us to grow well and to avoid disease. In fact, it is more economical and sensible to prevent a disease than to rush the person for a treatment. Because what medication does is it enriches the pharmacist, and it impoverishes the population, because they say that a patient healed is a customer lost. So they never say cure or heal. They normally use the words to treat or to manage. But sickness is not a property to be managed. I dare anybody tell me that when he is sick, he is happy to be managing the sickness over a period. Everybody who is sick wants to be cured or healed. People don't want to be managed, but they continually program people's mind to believe that whatever they know is the only way, which is not true. It is sheer bigotry. Even using the word an incurable disease is an insult, because knowledge is so much spread in the world by our Creator that I don't think any group of people can claim that what they don't know means that it doesn't exist. That's why we keep on sharing knowledge over and over again, from place to place. We share knowledge. So if you really want to be healthy, I think the best way to go is to get the useful knowledge that can save you from getting problem with your body. In fact, a simple thing like how to use cosmetics is a problem. To them, most of the cosmetics that our women use, apart from being harsh on their body, most of them are hormonal disruptors. Because 60% of what we put on our skin gets into our bloodstream. So if somebody is telling you to use a cosmetic and he says that keep it out of the reach of children because it's poisonous, then what about you who is using it if it gets into your body? And most of the herbs that we use in Africa, especially in Ghana, like the cassia alata, that we normally call nsimpi, this one. Most of our herbs that we use on our skin here are non-poisonous. They are not poisonous. So when they even seep through your sweat pores into your system, they do you no harm. No harm. And I wonder whether anybody would choose to be ignorant so that when he's sick, he goes to the hospital, then they load him with tons of medication and he becomes happy. Whereas if you have the knowledge, you have the right education on what to do, you can save a lot of situations. There are a lot of answers found in Africa through the simple passing on of knowledge from one generation to the other. You don't have to go to a huge, complicated institute to learn some very basic things. There are some of them that are so widespread that every corner that you go, whether it's in the Western region, Ashanti region, Eastern region, Volta region, the use of those herbs are the same. And I've given an example of how superior our knowledge about natural health is in Africa. In my book, there was a member of Vegetarian Association of Ghana, an expatriate who comes from Czechoslovakia. He was even having a column in the Weekly Spectator. He is called Alban Korim. He followed his friend to the Upper West when they were having the Bagre festival, and his friend's uncle, upon shaking his hand, was able to detect that Alban Korim has broken his hand and it was not properly fixed. This is somebody coming from Europe, the place that we think they have superior knowledge. It was not properly fixed. And this old man did not test his hands with any machine. Just by shaking him, he was able to detect that the hand was not properly fixed. And he was asked, and Alban Korim really confessed that it was true that his hand was broken 20 years before coming to Ghana. And this woman was able to detect that the hand was broken before and was not properly fixed. This shows the depth of knowledge our people have in various areas of health care and not sick care. And the lie that a lot of knowledge was being hidden because when people go and pick herbs, they hide them. That assertion is not even true, because one thing I realize is people who have a lot of knowledge always would like to share it. And especially in Africa or in Ghana, people ask you a simple question: oh, are you telling me that you don't know the use of this plant or this plant? And even how the plants were named really showed. There is a plant we call twenting. Many people don't know how it got the name. Twenting in Twi just means a tuya in ting, or it's a nerve or ligament mender. And that is what it was used to. That is its use. It's used in treating fractures, dislocations, and damaged ligaments and other things. And it works very perfectly. And this particular leaf, Philanthus fraternus, which they call Impie or Infanti, Abomeguechi, or the stonebreaker, is very, very, very useful. My reason for even showing it today is that I'm suspecting that some of the weedicides that are being paraded in Ghana for use are targeting some special weeds, especially this particular weed, which has a very universal use. And sometimes we are so naive about the wickedness of the people we are dealing with. These are people who can manufacture medicines, and they are DNA specific or DNA targeted to damage some people. So why wouldn't they be able to manufacture herbicides? Since we are so gullible and we accept anything from them, why wouldn't they be able to target some plants that they have seen are so popular in use, and it is helping a lot of people to move away from that unnecessary medication? And one thing we don't know is that this continuous medication is also a form of drug abuse, because people have been made to believe that every little thing they have to go for a drug. So people who normally have headache, some of them even have some painkillers like paracetamol under their pillows. Immediately they feel headache, they have to take it until they become addicted to them. And a lot of these painkillers go ahead to destroy the essential organs in our body, especially the kidney. And then when the kidney fails, they will never put it up to the use of these painkillers, but they will rather tell you that they shouldn't go to herbalists because it is herbs that have destroyed their kidneys. Meanwhile, this very herb I'm talking about, the stone breaker, is called a stone breaker because it breaks down and eliminates kidney stones, bladder stones, and all of that. So if you really want to get healthy, you must situate yourself in an environment or with people who will be able to give you natural cures, because most of the natural cures go with a lot of knowledge that you can pass on to your generations for the rest of your life. In fact, I have the chance of asking one of the very important personalities in the Ministry of Health in Ghana about whether they know the field trials that are performed on this so-called weedicides before they are brought into the country. And the answer was no. They didn't know. So what about if these people are intentionally targeting some plants to eliminate them so that people with the knowledge of those plants will not be saved from their medications? Because honestly speaking, medication is a business. And most of the time, when they come and talk about preventive health, to me, all they are doing is to get people, to give the awareness that people are having. They just come and do some free testing on whatever they want to give their awareness on, in order that they can sell medicines to you, which means you already have the problem. And they are just making you aware. Awareness is not the same as prevention. Prevention is to use prophylaxis, things that you don't have to be sick before you take. Most of the top herbalists that practice use a lot of prophylaxis, some herb teas that you take that builds your immune system over a period, and then it helps you to prevent a lot of things. So if we really are serious about health in this part of the world, then the emphasis must be on education, the right education, rather than medication. Because there is a funny statement they normally make. Oh, write the person to the nearest hospital. Now, those of us who have ever traveled to the hinterland, go to places like Aframple, and you are talking about write the person to the nearest hospital. How near is that nearest hospital? And even how safe can the person get there when the roads are not accessible and they are so poor? Wouldn't it be wiser if there is right knowledge and the person is educated on what to do and what not to do, so that we can minimize the effect of acute situations of sickness in the system, which is going to save lives, save time, and save the economy. Because if we are to make an honest assessment of the amount of drugs that are imported into this country alone in 1 year, and some will say that, oh, there are some pharmaceutical companies in Ghana. The truth is that these same pharmaceutical companies get all their components from their mother companies in Europe or elsewhere, and they just put them together. It is not like they are extracting things from sources based here to get them. So the emphasis is more on the money they are making than saving the lives of the population. And this is what we should avoid at all costs. Everybody, I entreat everybody to have at least some amount of knowledge on preventive health, and it will go a long way to save lives rather than depending on medication and we being proud that, oh, in my area I have so many pharmacies close to me, so I can easily go and buy a medicine when I'm sick. Okay, then make yourself sick and go and buy the medicine. The colonial masters who came here, they had a lot of medicines in Europe, but when it was very terrible, it was the herb, neem tree, that saved them. And I'm surprised we are not learning anything from our past. It is said that those who forget their past repeat it either consciously or unconsciously and suffer the consequences within it. So it's now up to us. Either we get ourselves educated in the basic knowledge about healthcare, or wait, and when we are sick, then we rush ourselves to the hospital. And this is not to say that all hospitals and clinics must be demolished. No. Those of us who are well-grounded herbalists, we also go to health centers, to get care when it is needed. But just like I said, and let me repeat it again, a poorly informed person is easily and destroyed. So we should not even allow ourselves to be ignorant about ourselves. Everybody, you are your best doctor. And if you are not educated on the right things, you are so gullible, you can be destroyed easily. That's why a lot of misinformation is peddled by those who want to make money at the expense of our lives and our pockets. So it's now open to us to choose. Do we want the education that will save our lives, or just medication? So those who want more knowledge on this information can get to the site of New Earth Foods and put your comments there. Okay, I think we've had a nice discussion about education versus medication. And you can get more inquiries from New Earth Health Foods. And also contact me directly on my WhatsApp on 0243 218785.